Hi everyone, welcome back to my channel. So I've been on a series on an addiction and all it entails, alright? But on this very video, we'll be talking about the sign and symptoms of an addiction. Unlike every other health condition, an addiction will not live for itself, a pointer to the fact that something is actually going wrong. Although we are talking on substance as an addiction, because we mentioned from the beginning of this very series that an addiction can put itself in different forms, which I would recommend us to check the first video on the concept of an addiction. So on this very one, the signs and symptoms we're talking about are actually that of substance use disorder. Okay, so we want to classify the signs and symptoms into four different realms. The first one is the physical, the second one is the behavioral, the third one is the cognitive science, and then the last one, which happens to be the psychological science. All right, so we'll go back to the first one, which has to do with the physical signs and symptoms. When we mean physical, it means those things one can directly see, can directly infer that, yeah, it seems like something is wrong. And these are what gets most persons worried. In fact, the physical and behavioral signs and symptoms are what makes the relative or any other person that is related to that very client to bring their client or themselves to present themselves for care and for management, right? Because at this point, it is eminent and very clear that something is actually wrong. So we want to look at 10 major things to watch out for when it has to do with the physical signs and symptoms of substance abuse. First of all is the bloodshot eyes or dilated pupils. Now, some persons will have blood, like a blood stain in their eyes, or blood coloration, which is reddish in color, colorations in their eyes. All right, and then some persons, their pupils will be dilated, just like someone who has passed on, pinned, that the eyes like pinned to one position. So it's one sign for an addiction. Next one has to do with the slurred speech and difficulty in speaking. All right. So some persons may have a kind of sluggishness in their conversation. So they'll be talking as though they were sleeping. And then some may even have difficulty in speaking. So you would know that this person is abusing substance. The next one has to do with poor concentration or balance. So sorry, poor coordination or balance. Some person may have issue in their movement, in their gait, so they don't have kind of balance when walking. You know that there's possibility that this person is actually on a substance. Yeah. So next one has to do with tremors or shaking. So you'll see involuntary kind of movement either in their hands or on their legs. So it will be shaky and shaky, something like this. So that shows you that there's possibility that this person is abusing a substance. The next one has to do with changes in appetite or sleep pattern. So some persons will tell you, if you had check with the record we made on the reasons why people go into substance abuse, though one of them is that some person will tell you, I can't eat well without the substance. Some person will tell you that I can't sleep well without the substance. This is very much common to hear from, especially people who are abusing marijuana. So they'll have issue with sleep or eating pattern, right? So when you see this, you know that there's possibility that this person is abusing a substance. Next one is weight gain or loss. Weight gain or you lose the weight. So just as we have said, if there's an issue with the appetite of that individual, more possibly if the person is not eating well, there'll be weight loss. And where the person is also overeating, then there will be weight gain. So this could be a pointer to the fact that there is possibility for substance abuse. Next one has to do with needle marks or the injection sites. So you can see that when you check those places, some may be at the hand, some may be at the deltoid muscles, while some may be at the gluteal muscles behind, right? When you see this, some may even be at the laps. Yes, when you see these injuries, continuous injuries, it shows you there's possibility that this person is abusing the injectable form of this substance. Yes, that is what it directly would point to, the injectable forms of the substance. More For instance, we have the pentazocine and the petidine. These are injectable forms. So if anyone is abusing this, they will need to inject them it on themselves. Yeah. So the next one has to do with the unusual odors or scent. Now there have been this very interview I went for where my interviewer asked me, say your client was brought in 3 days ago or several hours after abusing alcohol. Now, how would you know? How would you be able to pick out that this patient actually used alcohol? And say, to make the case worse, the client actually had taken his or her bet before presentation. So, how would you be able to figure out that this person has used alcohol? Yeah, so that tells us that some substance would be seen or will be perceived by their body odor or the scent that they wear. So that's one thing. For instance, marijuana, nicotine, which is the cigarette, and alcohol is common for you to know immediately after the person use. The person and that's why one thing you should know is that most of them go around because they know that most people are aware of this and maybe they don't want others to know. They will go about with spraying heavy perfume or cologne. You see them wearing heavy cologne or perfume. That shows you their responsibility that this person is actually using that substance. So where is alcohol? You can perceive it. Now, as I said in that interview, it goes beyond just the smell, although smell is one of those things, right? So you could see it in the gaits of the person who have that uh, issue with coordination or balance. You can see it in the conversation of that individual. You can also see it in the orientation. Yeah, we'll talk about that as we go forward. So what brought us here is the aspect of the odor and the scent. Now, the next one is changes in skin uh, tone or complexion. Complexion, yeah. Some of these substances can actually make one go anemic. Hence, you will see that they look pale. So there can be changes in their coloration, skin tone, or complexion. Now, the next one has to do with the poor hygiene or grooming. A couple of these substances, especially in the addictive phase, would not allow the individual to be mindful or pay attention to their hygiene, and hence you see them, they will actually have poor grooming or they haven't take their bath. So that shows you that there is an addiction, there's an issue with addiction. Now the next one has to do with the behavioral signs, and we have other 10 major symptoms too or signs you can be able to pick out to know that from this behavior there's possibility of substance abuse. So the first one has to do with mood swings or irritability. The a couple as high as 80 to 90% of persons who abuse this substance have issues with their mood. They are easily irritated with things, and their mood can swing from point of happiness, point of elation, point of depression, or point of anger. Yes, there's that tendency because it is working on the neurotransmitters of the brain and the hormonal system. Hence, the fluctuations in their mood. Okay. A second one has to do with increased secrecy or isolation. So a couple of them, yeah, they can keep secret. They can keep secret. And another major one you shouldn't put your eyes away, that you should pay close attention to, is that they isolate themselves. This isolation is one of the major behavioral signs in almost all forms of addiction, because a couple of the, for instance, the substance now we're talking about, they may not be comfortable to use this very substance in the presence of other persons. So because they are close, obsessed, and used to using this very substance, they want to isolate themselves. And then because they don't also want you to notice the sign and the symptom they are displaying, they will also isolate themselves from others. The isolation we're talking about is in the social aspect, right? So it is one major sign to look out for when we talk about substance abuse. Now, the next one has to do with changes in social circles or friends. Yeah, remember I talked about this in the reasons why most persons actually abuse substance. That a couple of them, if you are in that environment where they sell this substance, you may never know, you may never pick out that, yeah, there's possibility that this substance is sold in this place. But no matter how hidden that particular substance is, once the person using that particular substance is present in that environment, he or she knows the way of looking for that particular substance. How? One of that very way is that there is changes in the circles they keep and the friends they keep. Yes, there's changes in that circle of friendship. So, because through conversation and discussion between themselves, there will be that point where they talk about this very substance use. Hence, they can be able to tell themselves where they can purchase this particular substance. So the next one has to do with decreased interest in activities or hobbies. So where they were lover of a particular hobby or a particular activity, you see a switch in it. Yes, you see a major switch in it because they are preoccupied with the use of this very substance. So the next one has to do with increased absenteeism or tardiness. So a couple of them. Remember, I talked about isolation. Now, let's relate this to the work aspect because even persons who are actually in high profile jobs, they are also struggling with some forms of addiction. A couple of them, not all, please. Not all, please. So they would, especially when you notice that there is consistent absenteeism or absence of their presence, it shows you that there is something wrong somewhere. So one is the time where they will get that substance. Two is where they will use the substance. Three is how long they want that substance to last, that the height of that very sign would not be noticed by other persons. And when they will present themselves, where they can manage the presenting signs that they have used it. So because of this, they will have increased absenteeism. And then for those type of substance that will even knock them off totally, they may have issue with possibly the oversleep. Hence, they'll be coming to work very late, or they'll even miss for that particular day. There are some of those substances capable to even knock them off 2 to 3, 4 days. I've seen a case of 5 to 6 days. So there is that particular possibility. So when you see this absenteeism being consistent, it shows you there's a possibility of substance use or an addiction. And the next one has to do with dishonesty or deception. So a couple of them would not be honest in their conversation or what they do. Yeah, they have major issue with dishonesty, a major issue with it, and they can easily deceive other persons. So an instance is in their financial dealings where they can actually get contracts from you, make you feel as though they are the best person to do this, and make you feel as though they are already going to finish it in the next couple of days. But once they are able to get the finance to sponsor their addiction, off they go. So they will find that's why they easily find themselves with issues that relate with scamming people or owing debts. All right. So the next one has to do with increased aggression or hostility. It's possible because of that mood swing we talked about earlier. And then we should also know that a couple of persons without using this particular substance, they will not be able to involve themselves or carry out that crime act that they are common with doing in terms of their group. So let's use the aspect of robbery. Sorry for saying this. I just want to analyze something here. Let's say the aspect of robbery or the aspect of cultism, for instance. Because of this particular vice where they actually find themselves and the circle where they find themselves, some of them don't have that boldness to actually carry out this particular act. But because this substance will alter their perception and cognition, hence you find them using this substance just so that they can be able to face the person or the victim of their crimes. So this is actually common to see among them that are actually highly hostile with other persons. Next one is unexplained financial difficulties, which I've already mentioned. They can't manage their finance at all because with every bit of coin that comes into their hand or their possession, they will use it to feed their addiction. They can't account for monies. The next one has to do with changes in energy levels or motivation. You might see them extremely elated or extremely depressed. There is always difficulty with them staying within that balance point. It's always either to the depressed end or to the elated end. That's one of the things you should note in their behavioral aspect or manifestation. The last one that we should also pick out from the behavioral aspect is the paranoid or anxiety or on sign and symptom. They easily suspect other persons, that other person against them, other person hates them. They are easily suspicious of almost everything, and then they are anxious. They are easily anxious, maybe because of the side effect of the substance that promote anxiety or because of what it has done to their brain cell. Yeah, so because of this, you find out that a couple of them are extremely anxious. Now we move to the third one, which has to do with the cognitive science. In this cognitive aspect, it talks about how they look at things, they perceive things, all right? So they have issue with memory loss or memory difficulty in processing memory or to recall memories. So a couple of them, they have they can't remember things. They can't remember things. They forget little details. They are not detailed at all. Now, the next one is the aspect of difficulty in concentration. They can't concentrate at all because the substance, that's why they are called psychoactive substances. They affect the cognition of this patient. The next one has to do with the confusion or disorientation. Now, on this very aspect, when we talk about orientation, it simply means your ability to identify the place where you are, the person that you're talking with, or the person before you, and then the time of that particular moment. So they are disoriented in the time, person, and place. They are disoriented in it. So the next one has to do with increased forgetfulness. They can easily forget things. I've said that already. They can easily forget details. Next one has to do with decreased attention span. They don't have a longer attention span. So difficulty learning new information is possible among them. Increased confusion or disorganization due to the presence of this substance or absence of the substance. So we also have the decreased judgment or impulsivity. It is possible that they are always impulsive in their nature. In fact, when we talk about an addiction, you can't talk about an addiction removing obsession and compulsion. That's why obsessive compulsive disorder always go in 90 to 95% of clients who abuse substance. We also have the increased risk-taking behavior because of that particular substance that have altered their perception. They easily engage themselves in risk-taking behaviors. So we have the decreased self-awareness. Most of them, they doubt themselves, they have self-doubt. They also have that issue with over exaggeration of their self-worth. Yes, it's also there. Now we have the last one, which is not the least, the psychological signs and symptom. Now we'll talk about the psychological, it has to do with the mind. So we'll talk about either they have issues with depression or anxiety. It is possible because of the presence or absence of this particular substance. Now, we have mood swings or emotional instability, as we mentioned earlier. We have increased stress or tension resulting from the use or absence of this very substance. So, we also have decreased self esteem or confidence, which could be a major psychological challenge to them. We have increased feelings of guilt or shame, especially those persons who are trying to actually quit this substance. Let's say you were trying to stop this substance and then before you know you find yourself using it again. The next moment you feel disappointed with yourself. So the shame and then the guilt will step in. So we have the decreased motivation or interest in activities, as we earlier mentioned. So there's what we call ahedonia, where once something you once loved, you find yourself now not finding passion in that particular thing. Can come as a major sign of substance abuse. So we have increased feeling of hopelessness or despair, which is common in addiction. So I have decreased sense of purpose or meaning. A couple of them, in fact, let me tell us or share an experience with us. Of recent time, I have come to find out from interview with clients who has issue with substance use that a couple of them contemplate suicide. A couple of them contemplate suicide. There was this day I had to ask indirect questions to pick out suicidal ideations from my client, because I found out that a couple of them, some years or months along the way, they will be fine with they manifest or they either attempt suicide. So I wanted to pick out while in inpatient management what as in how many of them are actually already contemplating the suicide. I find out that those persons that even thought that they are stable enough for discharge were already at that point where they were contemplating suicide. In fact, they were so glad with that particular section because they were able to air out their mind and we could deal with some of those buried thoughts. So there is that increased hopelessness or despair when they are struggling. And this despair may be coming or hopelessness might be coming either from the struggle to quit that particular substance or the struggle with other life challenges. So we'll have the next one, decreased sense of purpose or meaning. I have those clients where we once asked, in the next 2 years, in the next 1 year, where do you find yourself? He said he find himself dying. So that tells us that a couple of them, because of this particular struggle with the substance, they may not see any reason to press further in life, to press for higher goals. So they rather would be seeing how possible they could end their life. Yes. The next one has to do with increased suicidal thought or behavior. I've already explained that. We have the decreased emotional regulation. Now, you may ask me, after mentioning all this, is it that you would see one of it? When you see this, you know that, for instance, someone depressed. No, not all depression, not all hostility, not all anxiety actually is sign of substance. We're only saying that a combination, yes, a combination of this particular sign and symptom could be a pointer to the presence of substance abuse. Also, it's not all clients that manifest all these signs and symptoms. It also depends on the duration which or that length of time, the severity of their use. So someone who have been using for 6 months and someone who started using last week or someone who has been using for 10, 15, 20 years, the sign and symptom will not be the same. So the sign and symptom can also overlaps themselves with other medical challenges. So if you are someone that is already suffering with this, you are struggling with substance, why not let me know in the comment box that you want to have my attention so we could talk about this, or you have someone that's struggling with this, let me know in the comment box. And just in case you also have other signs and symptoms I didn't mention, because I said the words what I just mentioned are just like the major ones you should be on the lookout for. So if you have other ones, you can also let us know in the comment box and then we can talk about it. All right, thank you so much for connecting. Thank you for always checking by. So I look forward to that very moment, that very day where this particular channel will be your most favorite click. And then beside that, just in case you actually want to suggest other topic we can talk about, let me know in the comment box. Thank you so much. See you on the next video.